Hello guys, and welcome back to my YouTube channel. In today's video, I will be talking about the breast cancer target therapies, and this will also be my third video in the breast cancer therapy series. In today's video, I will be separating my video into two main sections. The first will be the hormonal positive target therapies, and the second will be the HER2 positive target therapies. So I hope you guys enjoy and learn a lot from my video. So enjoy! So first I will be talking about the hormonal target therapies. The hormonal target therapies, as the name suggests, are for the breast cancer patients that have a estrogen or progesterone receptor positive. In this video, I will be combining the hormonal and the target therapies for the hormonal target and positive patients, and I will also just be looking at the main types. So first, most hormonal, or I shouldn't say most, because pretty much all hormonal positive breast cancer patients will first go through a therapy called tamoxifen. And I mentioned tamoxifen in my first journal meeting YouTube video, which will be linked at the top. And this tamoxifen acts as a estrogen receptor, which is one of the hormones in our body, and it mimics what the estrogen receptors would do and binds to the estrogen and then pretty much blocks it from further growth. And tamoxifen is on average given for about 5-ish years. And the side effects of tamoxifen include hot flashes, irregular periods if you are still on your period, the vaginal discharge or bleeding, and then mood swings, depression, weight gain, blood clots, muscle pain, and then different bone densities, and in a very, very, very rare chance, endometrial cancer or cancer that forms in the uterus. And as I mentioned before, my mom is a hormonal breast cancer patient, so she also did tamoxifen. And during tamoxifen, I do remember her having almost all of these side effects except for the uterus cancer and the weight gain. In fact, she actually lost a lot of the weight that she originally had. Then after tamoxifen comes letrozole. And what letrozole does is that it stops androgens in the body from forming into estrogens, which was the hormone that I just mentioned. And then there's also a shot named Zoladex. And Zoladex are pretty much shots given to females to stop the production of hormones in the ovaries so that the causes for the hormonal breast cancer can be decreased. And these shots are given once per month, and if you get really tired and sick and tired of these shots, what you can also do is that you can remove your ovaries through surgery. So then next are the target therapies. What before is more of a hormonal therapy, and then now is more of the target therapies for the hormonal breast cancer patients. So there are 3 main types for the target therapies for hormonal breast cancer patients, and they are the CDK4/6 inhibitors, mTOR inhibitors, and the PI3K inhibitor. So CDK4 and CDK6 are actually related to the cell cycle and cell proliferation. Blocking these proteins in the hormonal receptor positive breast cancer cells will help stop the cells from proliferating any further. The CDK4/6 inhibitors include palbociclib, ribociclib, and the abemaciclib. And the more company names for these in the same order that I listed are Ibrance, Kisqali, and Verzenio. And these drugs are able to block the proteins in the cell, or also known as the CDK4 and 6. So these inhibitors are actually taken with fulvestrant, and fulvestrant it just blocks and damages the estrogen receptors, and it can also be took with a aromatase inhibitor. But of the three, abemaciclib can be taken alone, while the other two, as I mentioned previously, will have to be taken with fulvestrant or the aromatase inhibitors. The side effects of the CDK4/6 inhibitors may include low blood cell counts and fatigue, nausea, vomiting, mouth sores, hair loss, diarrhea, and headaches. My mom also did a CDK4/6 inhibitor, and to be more specific, she did the palbociclib. And while she was doing the palbociclib, she got the low blood cell counts and the fatigue, but she also got like nausea and the mouth sores. What they mean by that is that like blister type of things will sort of form around the mouth, which causes the mouth to be sore. So I just wanted you to be aware of that as well. And she didn't really have the hair loss because she didn't really have hair loss or headaches, but I do remember her having the low blood cell counts, fatigue, nausea, and mouth sores. And actually, in my next YouTube video, I will be discussing a paper about how researchers found a way for fighting against the abemaciclib and palbociclib resistance in hormonal-positive breast cancer patients. So next up is the mTOR inhibitor. And the mTOR inhibitor that I'll be discussing today is called the everolimus, or in the more other term, it is called the Afinitor. So what this drug does is that it blocks the mTOR, which is a protein in the cell that usually helps the cells to grow and divide. And this mTOR inhibitor is also used with the aromatase inhibitor while being treated with either letrozole or the anastrozole. And the side effects of these include the mouth sores, diarrhea, nausea, like feeling down and like weak and tired, low blood cell counts once again, shortness of breath, and coughs. And these are more of the common side effects of the mTOR inhibitor. And then some other side effects may include an increase in blood lipids, also known as the cholesterol and triglycerides, and blood sugars. And finally, for the PI3K inhibitor, I'm going to be talking about the inhibitor alpelisib, also known as PI3K. And what this PI3K inhibitor does is that it blocks a form of PI3K protein within the cancer cells. And by doing this, it helps stop the cancers from growing. And however, this is very controversial because a lot of researchers currently state that the PI3K value is high in lots of other types of cancers as well as breast cancer. And like the previous two, the PI3K inhibitor can also be took with either the fulvestrant or the aromatase inhibitors. And the side effects include high blood sugar levels, signs of like kidney, liver, or pancreatic problems, diarrhea, rash, low blood counts, nausea, vomiting, fatigue, less appetite for food, mouth sores once again, and then weight loss, low calcium levels, blood clotting, and hair loss. And what I mentioned previously about all of these are actually took from the cancer.org website, so I have linked them right here, so I hope you will be able to check it out. And I will also link it down in where I write my comments and everything. And so to kind of talk about my story with this, my mom has actually took some of the drugs that I have listed for the hormonal positive breast cancer target therapies. Her order, if I remember correctly, went from the chemotherapy with Taxol and cyclophosphamide to Tamoxifen to Letrozole and Zoladex to her getting ovary surgeries because these shots for the ovary are like really long and thick, and she usually doesn't feel any pain, but she told me that it hurt a lot, and that's saying a lot if you know my mom, because she really does not like feel pain at all. So anyway, she got her ovary surgery, then she did palbociclib for 2 years, and then now she is currently doing the alpelisib. And in regards to the side effects, she got the nausea, diarrhea, the high blood sugar levels, fatigue, and the mouth sore in the early beginnings of one of her treatments. But as I have mentioned beforehand, which side effect shows up in which patients are completely dependent on the patient. Like, just because I'm telling you that my mom got these certain side effects doesn't mean that your parent will get the exact same side effects to the exact same intensity level that my mom felt it at. Like, in fact, your parent could have a less severe side effect, while others may have a very hard time with their side effects. But whatever it is, I really hope that you will be able to stay strong for the parent, and I hope that you will be able to take their minds off of it, because it's, as you probably very well know, a very, very hard time, especially once the side effects kick in and the side effects get stronger and stronger. So the second part will be about the HER2 targeted therapies. But before I go into what the actual details of the HER2 targeted therapy that I have prepared for you today, I would like to mention that my mom has actually never took any of these HER2 targeted therapy drugs or shots or IVs. So I may not know it to the fullest extent that I did with the hormonal target therapies. So I hope you guys can understand that part. And I'm also taking most of these facts off of the internet. So if you guys feel that something could be added or that something could be just fixed, please let me know down in the comments. So now I will begin. So for the HER2 targeted therapies, there are apparently 3 main types of HER2 targeted therapies. There are the monoclonal antibodies, the antibody-drug conjugate, and the kinase inhibitors. So starting off with the monoclonal antibodies, these are man-made versions of the antibodies or immune system proteins that attach to the HER2 protein on the cancer cells, and this later helps stop the cancer cells from growing. The examples of these monoclonal antibodies include trastuzumab, also known as Herceptin, and this drug can be used to treat either the early or the very late stages of the breast cancers. And it is often given with chemo, but it could also be used alone, especially if the chemo by itself has been tried. And if it has started before or after the surgery, this drug is usually given for about 6 months to a year. And if you're getting this Herceptin and you have advanced breast cancer, treatment is gonna be as long as the drug proves to be helpful. And Herceptin is usually given through an IV, which means that it's like injected into the body like directly instead of it being a pill that you can take. Another type of trastuzumab is called the trastuzumab and hyaluronidase injection, also known as the Herceptin Hylecta. It is pretty much given under the skin, and it is a shot given over for a few minutes. The next target therapy drug in the monoclonal antibody section is the pertuzumab, also known as the Perjeta. And this can be given with either the Herceptin and chemo, either before or after, to treat all types of the HER2 positive breast cancer types. And this drug, like the previous one, is given through an IV. And for people getting both of the monoclonal antibodies as part of their treatment, so the Herceptin and the Perjeta, there is also a combination of the trastuzumab, pertuzumab, and the hyaluronidase, also known as Phesgo. And this is also available, and it is available with a single injection, and this is a shot that is given over for a couple of minutes. The next type of HER2 target therapy that I'll be talking about today is the antibody-drug conjugate. The antibody-drug conjugate is actually a monoclonal antibody that is linked to a chemo drug. And in this HER2 positive target therapy case, the anti-HER2 antibody will attach itself to the HER2 protein in the cancer cells, and then it will bring the chemotherapy directly to itself. And examples of these include the adatrastuzumab emtansine, or the Kadcyla, or TDM1. And this is used to treat early stage breast cancer patients after surgery. So pretty much when the chemo and Herceptin is given before surgery and there is still cancer present at the time of surgery, or to treat the advanced breast cancer patients in women who have already been treated with the Herceptin and chemo. And this is also given through an IV. Then there is the famtrastuzumab deruxtecan, also known as Enhertu. And this antibody-drug conjugate is used by itself to treat breast cancer that can't be removed with surgery or that has metastasized or spread apart to other parts of the body. And this is given typically after 2 other anti-HER2 targeted drugs have been tried, and it is also given through an IV. So, final section is the kinase inhibitors. So why these kinase inhibitors are given is because HER2 is actually a type of protein that is known as a kinase, and kinases are proteins in the cell that normally give signals to other parts, and it for instance tells other cells to grow or to do something. And the drugs that are used to block these are called kinase inhibitors. Therefore, why we have kinase inhibitors for these HER2 positive breast cancer patients. So the types of HER2 kinase inhibitors include the lapatinib or the Tykerb, and this is actually a pill, and the lapatinib is used to treat especially the advanced breast cancer patients that the advanced breast cancer patients alongside with a chemo drug called the capecitabine, or with a certain hormonal therapy drug. Then we have the neratinib, which is also known as the Nerlynx, and this is also a pill that is taken on the daily, And the neratinib is used to treat early stage breast cancer patients after the patient has gone through at least 1 year of the Herceptin, and this drug itself is also given for a yearish. And it can also be given alongside the same chemo drug, capecitabine, to treat the patients if they have a metastatic disease. And this happens typically after 2 other anti-HER2 drugs were given and they just did not work as expected. The final type is the tucatinib, or also known as Tukysa. And this is also a pill, but this is taken twice per day. This pill is used to treat advanced breast cancer patients after at least 1 other anti-HER2 target drug has been tried. And this is also given alongside with Herceptin and the chemo drug capecitabine. So, as all drugs and therapies do, these HER2 target therapies also have side effects. The monoclonal antibodies and the antibody-drug conjugates can actually sometimes cause heart damage during or after treatment. And later, if this gets really serious, it can lead to a congestive heart failure. But most women, actually, this effect just lasts for a short amount of time and gets better once the drug is actually stopped. And the risk of getting these heart problems is actually just bigger if you take these target therapies alongside chemo drugs that could also cause heart damage, such as doxorubicin, or also known as adriamycin, and the epirubicin, also known as Elents. And most doctors will check everything related to the heart because of this. And the website that I found this at stated to let your doctor know if the patient develops a symptom such as shortness of breath, leg swelling, and severe fatigue. And the lapatinib, neratinib, and the tucatinib, and the combination of the pertuzumab with trastuzumab can also cause severe diarrhea. So you have to let your doctors know about all these changes that are happening to your body, especially if you think it is due to the drugs. Finally, the lapatinib and the tucatinib can cause something known as the hand-foot syndrome. And this is when the hands and feet become sore, red, and may later blister and even peel. And the lapatinib, neratinib, and the tucatinib can actually cause liver problems. So during the treatments, most doctors will go do blood tests to check the liver functions. So, yeah. And these liver problem symptoms include itchy skin, yellowing of the skin, or yellowing of the white parts of your eyes, or you have darker urine, or there is pain in your upper belly, or there's just, you feel like you have like some sort of problem going on. And then the trastuzumab deruxtecan, or also known as the Enhertu, can cause serious lung disease in some women. However, this is very rare, so I hope that you don't mind yourself too much with this type of side effects. So, this was the end of video number 3 in the breast cancer therapy series. I hope by watching this video you may have learned a lot about the specific target therapies for the hormonal positive breast cancer patients and the HER2 positive breast cancer patients, and you would have learned to take care of your parents, because they go through a hard time once they take these drugs, and it's very hard for them to just to remain positive in such a state. So I hope that by watching this video you'll have gained more like compassion and feelings to help your parent out in this time of need. My next video, as I mentioned before, will be talking about a paper in a journal that recently mentions about how we can fight against abemaciclib and the palbociclib resistance. Thank you again, and have a good day.